Well, in Health First, we're going to learn more about the WATCHMAN procedure at Lima Memorial Health System. Joining us today, the Structural Heart Coordinator at Lima Memorial, Natalie Lammers. And thanks for joining us.
Thank you for having me.
Okay, so let's first start. Apparently this procedure is for people on blood thinners and with AFib. So let's talk more first about what is AFib and the blood thinners all about.
So atrial fibrillation causes your heart to beat irregularly. And so it can affect the heart's pumping function of the blood. And so the blood can't pump normally. And so it can collect and form a clot in a pouch in the upper chamber of the heart called the left atrial appendage. Now, if that clot would escape, it can cause a stroke. And so patients who are diagnosed with atrial fibrillation, we prescribe blood thinners like Xarelto or Eliquis or Coumadin to prevent those blood clots from forming in the first place.
Okay, so it sounds like there's an option, the WATCHMAN. That's an alternative blood thinner, so explain that. Tell us more.
So the WATCHMAN is actually an alternative to patients who have atrial fibrillation but cannot take blood thinners long term. So those would be the patients that have had multiple falls or at risk for falling, have had a major bleeding event, or have hobbies and jobs that might increase their risk of injury. So the WATCHMAN procedure is a permanent implant that creates a barrier and closes off that left atrial appendage to prevent a blood clot from escaping.
Okay, so if you're a patient, what would you expect like before and during and after then that procedure?
So at Lima Memorial Hospital, our interventional cardiologist will make a tiny incision in the upper thigh and insert a narrow tube. The implant is guided through that tube into the left atrial appendage. The procedure is done under general anesthetic, and it typically takes about 30 minutes. Patients are discharged the next day, and they have about 2 to 3 days of restrictions. Now, it does require that they be on blood thinners for a short amount of time, just enough time so that heart tissue can grow over the implant and create that permanent barrier to prevent those blood clots from forming or escaping. So at 45 days, we do imaging to ensure that that barrier has been created. And then we decide to take the patients off their blood thinners and possibly be put on a low dose aspirin lifelong. So the whole point of the WATCHMAN, or the main benefit of the WATCHMAN, is to prevent stroke in our atrial fibrillation patients, but also decrease their bleeding risks, essentially. So,
Right. I assume you've got a good response when people get this, that they're like, wow, this has really changed.
It changes their quality of life because they no longer have that worry of being on blood thinners.
Yeah. All right. So if a person's interested in this WATCHMAN procedure, what kind of steps do they take to get there?
Well, for more information, they can go on watchman.com for more information about the procedure. But if anyone is interested in the procedure and want to see if they are a candidate, they can call my office at 419-998-4404.
Yeah, start there and get more information. Well, Natalie, thank you very much for explaining this procedure to us today.
Thank you.
All right, don't go away. First Edition continues in a moment.